Hey everybody, I'm Chef AJ and welcome to Healthy Living. My guest tonight, back by popular demand, is Dr. Garth Davis, the author of the new book, Proteinaholic, which we'll be discussing tonight. Dr. Davis is a leader in the field of bariatric medicine, and he stars with his father, Dr. Robert Davis, on the hit show docu-reality medical series Big Medicine, and he is also the author of the bestseller, The Expert Guide to Weight Loss Surgeries. So please welcome back Dr. Garth Davis. Thank you so much for coming back on.
Thanks for having me, AJ. It's great to be on.
Yeah, I want to talk about your book because, it's great. I don't know if you know this, but it's really good.
I put a lot of effort into it. I mean, it took a lot of effort.
And let me tell you why I particularly love it. Well, it's just a great book, scientifically, everything like that. It's very well written, but you really did put your heart into this book. And, there's a lot of great books out there in the plant-based world, but so many of them, we read the book and, we learn a little bit about diabetes or heart disease, but we know absolutely nothing about the author. And, there's an old saying, Dr. Davis, we don't care how much you know until we know how much you care. And it was quite obvious that you care deeply, but I loved that you shared your story because, I've seen you at conferences and we've even had, a couple meals together, but it made me feel like I really knew you, because you put your story in such great detail in the book. And I wish more authors and more of the plant-based doctors in particular would do this because so many of them I've known for years and I know not one thing about them,
Right. Well, I like the change for me going to a plant-based diet was so eye-opening and so beneficial to my health and to the health of my patients and my family that, I just wanted to shout it from the mountaintops. So I thought, I would love to give my story because I think, as much as the science is important, knowing the stories are important too.
I agree. It's funny, though, that you use the word eye-opening because my first question is it was a fateful eye exam that I guess was supposed to be a routine eye exam that really changed the course of your life. So why don't you talk a little bit about how just an eye exam kind of got you where you are today?
Yeah, you know how you are in your 30s. You don't really think about your health that much, and especially as a doctor, you get to this point as a doctor, you kind of feel somewhat invincible. And I thought I was eating healthy. I mean, I wasn't necessarily a junk food junkie, but, it was eggs and bacon for breakfast. There were certainly hamburgers thrown in, but it was usually grilled chicken. I thought I was doing a pretty good job. Two fateful things happened. It was the eye exam, and at the same time, I was having a baby, and I went to get a life insurance policy, and both basically said the same thing. So the eye exam, the optometrist kind of went away from the eye thing. She goes, you've got Arcus senilis. So Arcus senilis, I know from my medical school days, is a disease that it basically means you've got very high lipid levels, and you usually only see it at really old people because they've developed these lipids over many years. So I was a little bit shocked by that, and a few days later I actually was getting my labs checked. And I was going for a life insurance policy, and I got turned down to like the best rates because my cholesterol levels came back really high, my triglycerides were high, and I was hypertensive. And that really threw me for a loop. That really shocked me.
I didn't even know an eye exam could even, diagnose these conditions. I mean, I got to get my eyes checked all the time, but I had no idea. So good for them for finding it,
Yeah, it was really good for them.
Yeah, see, so that's just see, we all have a like a turning point, and I think that might have been yours, huh?
Oh yeah, it was a huge. I mean, I could remember as if it was yesterday. It was a huge turning point in my life for sure.
Well, you should go back and give that eye doctor your book.
Yeah, I probably should. That would be funny. Funny enough, I think I even remember her name.
That would be great.
It's been a while now, but yeah.
But still, if you could find out and say, hey, you know what? Thanks to you, this is where I am today. I think that'd be kind of cool, actually.
Yeah, I might actually try to track her down tomorrow. That's actually a good idea.
Yeah, it is, because I've done that in my life. People that have either said something to me, even years ago, I've found them and say, you said this thing to me 20 years ago. You won't remember me, but thank you. It made a real difference in my life. So that is really cool. You probably know there's a show on right now called My 600-Pound Life, and maybe you've even seen it on TLC. Mm-hmm. You maybe even know the doctor on it because I think he's in Houston, right?
He's in Houston, yeah, I know him well.
Right, and so what's interesting to me, of course, the show, it's very sad, but the take-home message in that show, what he tells all his patients, is eat protein. Eat protein. That's
you want to know? You want to know the funniest story is this lady comes to see me and she's 550 pounds. He does the weight loss surgery and he does the plastic surgery. Okay, and he deals with a lot of overweight patients. And And so this lady comes to see me. She's 550 pounds, and she wants weight loss surgery. And she's been turned down by many doctors because she's too big for weight loss surgery. They're worried about doing her. So I sent her to me, and I said, look, I'll do weight loss surgery on you, but first I want you to lose some weight for it to be safe. So I go in to my usual spiel about plant-based diets and look around the world, and let's go over the food. Let's see what you're eating. Why don't you try this instead of eating that, et cetera, et cetera. Well, she goes on a plant-based diet, and she just loves it. Her weight, just every time she comes in, it's dropping. And she goes from, God, she must have been in like 550, almost 600 pounds. She goes down into the low 300s. So this dramatic, huge weight loss. And she continues losing. I just got a Christmas card from her today about how excited she is because she continues losing. But she lost so much weight that she got this huge pannus, like this hanging skin. So she decided to go to him, to Dr. Nazardin from that show, to get a paniculectomy where they just cut off that pannus. And he sees her and he says, "You need weight loss surgery." And she said, "Oh yeah." The first thing he says is, "You need weight loss surgery." And she says, "Well, listen, I understand how you might think that, but you're seeing me, after I've lost, all this weight, and I keep losing weight, and it's coming down very well, and I'm exercising now, and if we take off, this hanging skin, I can exercise more, and I think I'm doing well without surgery." And he says, "That's absolutely ridiculous. Who told you that?" She said, "Well, I'm seeing Dr. Garth Davis, and he has me on a plant-based diet." And he said, "A plant-based diet? That guy's a quack."
Oh my gosh.
Yeah.
That is hilarious.
Yeah, so she came back to me, and I did her paniculectomy, and now she's just kicking butt. She's in her, she's as low weight, she said, as she's been since she was a teenager or something like that. She's really done well.
That is that's it's funny. It's sad, but funny at the same time that he would say that.
It's funny, but it is sad. There's so many of the. So I have fellows that I teach, and my fellows, they go with many different surgeons. So they spend like a few months with me, then a few months with another surgeon. So the one person in our group is in San Antonio, and my fellow was telling me, she was over there, she's like, they tell their patients eat bacon and eggs for breakfast, and like nothing but protein, and you should eat your protein first, and don't ever eat fruit. That's what they tell their patients. I mean, this is absurd. And so I said to my fellow, I was like, look, I'm going to ask every patient that comes in, who comes to see me today, what they eat, and see how similar what they eat is to the diet that's being recommended by these doctors after surgery. And it was exactly the same. People were like, "Oh yeah, I have like eggs and bacon for breakfast, and I eat a lot of chicken." It's the exact same thing.
It's criminal to me. Now I don't want to judge because I know the TV does add weight, but that doctor on the other show, he doesn't look as good as you.
No,
I mean,
he's not fit, and he's he looks. You know how it is with TV. His son's a TV producer, got him a little show, and he got a little thing. But I had a TV show on TLC, and people would always be like, "Okay, well, you're the expert." And I always tell them, being on a TV show does not make you the expert. That's for sure.
Well, one of the things you say in the book, is that gastric bypass surgery doesn't address the root cause of obesity.
It does. Look, the surgery works really well. So I hate to knock it too much because when I have done studies comparing my surgery patients to my medical patients, my surgery patients do far better. But I'm putting my surgery patients on a good diet too, so it's hard to measure. But if you look at the surgery results, they're really good. Now, what the surgery does is it affects. Overweight, being obese is. People always they balk at this idea of it being a disease, but it is clearly a disease. There is genetic components to it. We've got functional MRIs showing that the brain looks a lot like an alcoholic's.
Yeah.
And so what the surgery does is address some of what that genetic can be. Like if you look at someone who's overweight, they tend to just be hungrier than a normal person. So, until you walk a mile in someone else's shoes, you got to understand that they feel different than the average person. And they've got a slower metabolism, all that stuff. But as you very much know, because I know your story, a high fiber, low calorie density diet can take care of a lot of that hunger just as well as a weight loss surgery if it's done correctly.
Yeah. Well, look, but I get this question all the time, and actually, people wrote in tonight with this. Is that we talk about a high fiber, low calorie dense diet, which is a volumetric diet, so it's larger volumes, and people that have already had the operation keep saying, well, can I do this? Can I do this? Because I guess they can't eat as much as in volume as like I do.
Yeah, I mean, this is true. They can't, but they get satisfied with enough. Like there's, it's kind of funny to me because people are always like, how can you get enough? It's the same thing with kids, right? They say, how can you get enough nutrients on a plant-based diet? I mean, this is so ludicrous to me when people are eating, people will say to me, how do your kids get enough vitamins from a plant-based diet? And I'm watching their kids eat hot dogs while my kids are eating a salad with chips and hummus.
Yeah.
With carrots, chips, and hummus, and it's just ridiculous. I mean, my patients are eating very nutrient-dense foods. They're able to get salads down and vegetable soups and potatoes and stuff like that. They don't get nearly as much as probably you do or other people do.
Right.
But that's the beauty of it, is they don't need to eat that much to feel satisfied.
Good.
But the amount that they do get in is more than. I mean, can you get a weight loss surgery to do a plant-based diet? I think I've got almost 10 years, well, not 10 years, but probably about 7-6 years showing that people absolutely can do that very successfully. In fact, the more plant-based they are, the better off they seem to do.
They just can't eat like for instance, okay, I posted my lunch on Facebook today, and it was 2 pounds of zucchini and a 2-pound sweet potato. It was a huge volume of food. They couldn't eat all that in one sitting the way I can.
They can't. No, there's no way.
They could break it for the course of the day, maybe, or several meals.
They can eat during the course of the day, but my argument would be they don't need that much.
Oh,
I mean, the one thing we're getting from science is less is probably better when it comes to what we eat, calorie intake, etc. There's definitely something to fasting. There's definitely something to very low calorie diets over time. The problem is it's very hard to stay on a very low calorie diet if you're hungry all the time, and what the surgery does is allow you to do that.
Yeah, that
but less is more. In the anti-aging world, it's looking like the least is the best. But it's like there's this group of people that follow this. There were quite a few, and you were at that conference at Fontana was talking about it.
Yeah, the calorie restriction.
Yeah, and so a lot of people followed that research, and a lot of very smart people started doing this very low-calorie diets where they barely ate. And it was funny because there was an interview done on them, and they're like, these people are really healthy, but they all seem really angry because, they're just so hungry all the time. But after this weight loss surgery, the one thing it does is really make you not that hungry. But again, it's not like I guess people get this misconception that you're eating like tiny little bites and that's it. Once you're about a year or so out from the surgery, I mean, you're eating 8 ounces at a sitting. And it's just 8 ounces of healthy food is what I want them to eat.
So I read in your book that it makes you not as hungry because you're bypassing that certain part of the stomach where there's some hormones and
right.
but then there are some people that have had the surgery, and then, like even you mentioned, they do gain it back. So
sure.
Do they then at some point become hungrier, or is it an emotional thing that makes them eat? Or
it's so funny. The research on this is really interesting. So the hormones that control hunger seem to go away for the first year, but then start to come back.
Interesting.
Now, with some people, if the surgery wasn't done correctly, the stomach could really expand a bit too much. And so they're just able to eat more food. There's certain technical things with the surgery that could go wrong that could make people eat more. But what's interesting is, and it's mainly been based on rat studies, but it's starting to be seen in human studies. They wanted to know, why does gastric bypass work so well? Because while it does restrict calories, in a lot of people, they don't get that calorie restriction that much, and they can eat more than another person with a weight loss surgery. And these hormones we talk about, like ghrelin and GLP-1, they go down, but then they seem to rebound after a time. So what is it that makes the gastric bypass surgery so good several years out? And what they are finding is it may have something to do with a change in the bowel bacteria, in the microbiome, which is very fascinating. And I wonder if they're just eating, less foods that affect the bowel bacteria, i.e. less meat and less dairy, and possibly people are eating a lot of meat and dairy because their doctors tell them they need high-protein diets after weight loss surgery, possibly are getting bad bacteria because of that, possibly are gaining bags of weight. But I see a lot of patients who come to see me, and they're like, they've had weight loss surgery somewhere else. They were told to eat protein first, and I told them never mention the word protein in my office again. And I put them on a high-fiber diet, and they do fantastic. They lose weight like crazy. A lot of this may have to do with the fact that the high-fiber diet provides prebiotics and helps the good bacteria grow more. I don't know that we could say that for a fact yet. I could just tell you that people on a plant-based diet do really well after weight loss surgery.
That's fantastic. One of the most interesting, you were talking about the gut, but one of the most, what I also liked about your book is that even though there was a lot of science in it, it was readable. Like I'm not a doctor, but I was able to understand the parts that were scientific, which in some books you can't. So I appreciate that. But one of the things I learned, because I love learning things that are completely new to me, is you said that our gut bacteria can make the so-called essential amino acids, the ones that we're supposedly able to get only from food, and recirculate them into our system. That is so cool because, we've heard that, you gotta eat protein, or you gotta complement it. And that's awesome. Like, where did you learn that? That is not widely known.
Yeah, that's completely, this idea of complementary proteins is completely false. This idea that at each meal you need to get this 100% of all the different amino acids. The fact is that our bodies are constantly breaking down our muscle tissue, our hair cells, our intestinal cells, and recycling that protein and recycling those amino acids. So there's a constant labile supply of amino acid in your bloodstream at any time, and can be used for any activity. If I just finished a workout, my muscles now need protein. They can use their cells. I think Doug Lyle has this great thing where people, because we always get this question, right? Where do you get your protein? And he says human flesh. Because he's recycling his protein. But the studies on that are very dramatic and very indicative of this very old concept that you need complementary protein is just completely false.
Yeah, that's great. Early in the book, you were saying that you were well on your way to the same chronic diseases that your patients were suffering from: hypertension, heart disease, and diabetes. And who was I to tell them what to do when I didn't have a good solution myself? Why can't all doctors say that?
It's a strange thing. So I don't have an exact answer for that, but I'll tell you that we're just never taught in medical school nutrition very much, nor are we taught the fact that nutrition has anything to do with disease. Disease is a completely separate entity in a doctor's mind. And I gave a talk to a bunch of endocrinologists about, meat and diabetes. And, I've got so much research on meat and diet. That diabetes section is just loaded with research, right? And so I present this, and, the endocrinologists are looking at me with this kind of dazed over look. They know they can't argue with me. I got clear research. So one of them raises his hand and like, all right, look, maybe this data is correct, but here's the thing is, patients aren't going to change their diet. They're not. So we need to treat their bad habits. And that's the basic idea. We're going to give you Lipitor for your high cholesterol. We're not going to tell you to eat less saturated fat because you're not going to eat less saturated fat. It's this paternalistic view that we can't change your diet. So, and the other thing they know is they know that they don't have the time to sit there and go over a healthy diet. Hell, they don't even know what a healthy diet is.
Right.
So this just isn't their purview of treatment. Now, I happen to be in a field of weight loss where I felt like this was my purview of treatment, so I needed to learn this stuff. But, a lot of them just think, look, I'm a cardiologist. I don't know anything about diet. I don't know how to counsel someone about diet, so I'm going to give them Lipitor. And treat their cholesterol. It's what I was trained to do. I know it has a measurable effect, so that's what I'm going to do.
Right. So treat the symptom, not the disease.
Exactly.
I also love when you said, I had come to view the human body as a kind of expensive, unreliable car, something that was always breaking down and needing to be repaired. I was totally focused on treating disease. Prevention really hadn't entered my mind. And I bet now it has. And if you keep doing what you're doing, you're going to put yourself out of business.
I'd love to put myself out of business. Like my fellow today who was shocked that I saw all these patients for weight loss surgery and I was trying to convince them not to get weight loss surgery. You know, I mean, there's certain people, look, you've been overweight since you were, 5 years old, going to fat camps and been on a million different diets. Yeah, surgery's great. But I saw a bunch of people today, they've gained weight over the past 5 years. They've only done Atkins. That's the only diet they've ever tried. They don't really have a strong family history. And I'm like, well, listen, I mean, I go through their diet log. I'm like, look, you're eating eggs and bacon for breakfast, which, by the way, at least here in Houston, is everybody's breakfast, and everybody's eating, sandwich meat with bread for lunch with chips, and everybody's eating their pot roast and steak dinner, fajitas and whatever. And so I'm like, oh, well, there's some simple things we could do that could really drop your weight without me cutting you open and rearranging your anatomy. And so, yeah, I'm much more focused on prevention. And the future of medicine really might change with the advent of some of these changes in the way we deliver healthcare. For instance, if you look at Kaiser Permanente, that's an HMO. So you got to understand, they make their money by keeping people healthy. So most the current model is we get paid for doing procedures. I get paid if I cut on you. And so there's an incentive there now. I mean, most there's certainly exceptions, but most doctors are not or should not be thinking about financial issues when they're treating patients. They should do what's best for them. But there's definitely a incentive to treat. That's just the way it's set up. But now with the Kaiser system, each person that buys into the Kaiser system is paying Kaiser a certain amount of money, and that money covers all treatment they get. So the less treatment they get, the more money Kaiser makes.
Yeah.
And so Kaiser's just come out with a really big statement to primary care doctors that plant-based diet should be used for prevention of disease and should be used in early stages as treatment of the disease. That's a big move when a big, huge health industry giant like that starts advocating a plant-based diet.
That's so cool. I've had the pleasure of speaking there a few times, and I'm going to be speaking there again in January. And even if that's the reason, it's financial, we don't care because it's going to get people well.
Right.
That is so cool. I think one of the most profound things you said in the book was, the Hippocratic Oath would come back to haunt me when I realized just how much harm I and my colleagues were doing to our patients, just how badly our protein, and more protein advice was setting them up for obesity, hypertension, heart disease, and cancer. Then some strong words,
Yeah, they're strong words, and I'm sure that, my colleagues kind of resent it at times. But look, it's the truth. I mean, there's no question in my mind after doing more than ample research and having more than ample experience with this matter that this advice to eat more protein is just making people sick. I mean, look at this country. We've had this advice to eat more protein for years now. How are we doing? We've got one of the highest obesity rates, the highest diabetes rate, cancer numbers are high, hypertension, all this stuff, we're not healthy on these high protein diets. We're just not healthy.
Well, for someone who's just maybe listening for the first time that isn't, involved in the plant-based world yet, how does eating all this protein make us fat and sick?
Well, it's a very complex web, and I try to go through a lot of the science in as interesting a format as I can in the book. But there's several things that happen when you eat animal protein. Number one, it stimulates IGF-1, which is a growth hormone. Growth hormones will tend to make you fat. If you work out a lot, it might give you some muscle, but it also stimulates cancer cells. And so the IGF-1 has been associated with colon cancer, prostate cancer, breast cancer, etc. When you eat animal protein, it always comes with saturated fat. Saturated fat has multiple different negative effects, including heart disease and elevating cholesterol. It also causes the intestine to become more permeable, and animal protein almost always comes with bacterial endotoxins, and so the endotoxins get into your system, and you get an inflammatory response. So animal proteins are very, very inflammatory. They're also very acidic because they have a higher amount of amino acids that have sulfur in them and that are acidic, plus animal protein foods don't tend to have a lot of electrolytes with them, so you tend to turn your diet into a more acidic diet, which has been associated with disease and inflammation. Animal protein usually comes with ferric. Am I boring you yet? Should I keep going?
No, not at all.
Yeah, animal protein comes with a type of iron that's very oxidizing, and that causes a lot of disease. When you cook animal protein, it creates heterocyclic amines, which are formaldehydes that get into the body. There's certain viruses and antigens in meat, like mu5GC and thermoresistant viruses. And I mean, there's so many different things that when you eat an animal protein gets into your system, causes a problem. And that whole thing with the microbiome may be one of the main things. This, they did this study in Nature, which is, one of the main scientific journals, that showed astoundingly that just within a few days you could completely change the type of bowel bacteria that you have in your bowels between a good bacteria and a bad bacteria just by switching between meat and vegetarian.
Yeah. And when you say protein, you're talking not just about meat, but you're talking about dairy too, right?
I'm talking about dairy. Yeah, a lot of the inflammatory studies, like they did a great study where they had people drink water, orange juice, because they wanted to see if sugar was involved, or cream, like or I can't remember if it was whole milk or cream, but either way, the cream shot the inflammation up huge. The water and orange juice did nothing. And the same thing with vessel dilation. They've shown that, consumption of a high animal protein meal creates this problem with vasoconstriction of your blood vessels, which of course can lead to heart attacks and things like that, and vessel damage. So yeah, lots of stuff.
The people that come to you, in 500 pounds, looking for gastric bypass surgery, they didn't get that way just by eating just protein, right?
No. Look, the protein is not the only. It's not the only. Look, obesity is way too complex for there to be one answer to it. It's not just eating protein, but that's a huge part of it. And they're eating too many calories, and part of that could be because when you look at the calorie density charts that you like to show,
sure,
meat is above the 500 calorie per gram,
like,
and so they're eating a high calorie density food. It's stimulating IGF. It does stimulate insulin secretion. It also stimulates fat deposition in muscle cells, which creates insulin resistance, and that's a whole different thing. So then they get really high insulin levels, and the really high insulin levels, that's another thing causing fat to be discussed. So it's this whole complex web of things that make people obese. It's not just fat. But I'll tell you one thing that's really interesting. Carbs don't make you fat.
Yes.
It is extraordinarily hard for the body to turn a carbohydrate, even pure sugar. It's very hard for your body to turn pure sugar into fat. It burns it or it stores it as glycogen.
Right.
And that's its only choices unless you're eating way over your calories that you're supposed to eat, and you've completely saturated all your glycogen stores, and you're not exercising to burn those glycogen stores. Mm-hmm. And so there are people that do that sit around and eat, 5,000 calories, and they're eating, tons of junk food, and so maybe carbs in them will turn to fat, which is called de novo lipogenesis. Right. But in the average person, like the idea that potatoes can make you fat is just ludicrous. Same with rice. The Asians eat tons of rice, and they're much thinner than we are. And probably one of the best diets that's ever been put on the face of the earth, or at least from a scientific standpoint of treatment of disease, is the rice diet.
I thought you were going to say that. Yeah, my brother actually, who was morbidly obese, went on that, and it's the only time he ever lost weight, other than the Ornish program. So yes. Much plant-based diet's not working. It cracks me up when I watch that show, and they say eat protein, and then they go eat bacon and eggs. I look at bacon and eggs as more fat than protein anyway. Protein is like a protein powder. That's protein. Bacon and eggs to me is fat. It's
this is absolutely true. The way the fact that we've dropped down into this reductionist nutrition where we call things by macronutrients is ridiculous. So when I say carbs are good for you, people say that means a donut's good for you because they think a donut is carbs, but a donut's way more fat than it is carbs. Mm-hmm. Same thing with ice cream. Same thing with pizza. All these things that we tend to say are quote-unquote carbs are actually fats if you're going to do it that way. There's nothing I hate more than, I think I mentioned this in the book, I'm not sure, but if I'm ordering a salad, and they always ask me, this is like the new...
Oh, yeah. What do you want for your protein?
Yeah, what protein do you want with that? That just kills me. I'm like, what do you mean what protein do I want? They're like, would you like chicken? I'm like, well... there's more fat in there than there is protein. So are you by calorie? So are you asking if I want fat with my salad. You know,
that is so funny. We get that here in those build your own salad restaurants. Well, would you like a protein with that? I go, no. There's already more protein in the kale. I tried.
Exactly.
Yeah. I love your personality, by the way. You remind me of McDougal, and I mean that with all the love I can muster, because I always worry because he's getting up there, like who's going to fill his shoes? Well, you are, because you're just so passionate. Were you always this passionate even before you adopted a plant-based diet? Is that just your personality, or are you just mad as hell because of what's going on? And that's
funny. I've never felt more passionate in my life than I have since I've learned about a plant-based diet and the benefits of it. I mean, you got to be somewhat passionate to become a doctor, and especially a surgeon, because you know, it's hell getting through it. But I can't say I've ever been I certainly have never been an activist like I am now. I've always been somewhat loud, though, I guess.
Yeah. Well, people, if they aren't already following you on Facebook, they should, because, you know, I think that someone should just take all your Facebook posts, and that should be a book.
That's sweet. You know, Howard Jacobson, who went over my book when it was done and helped me change up some chapters and make them more readable, is a really great guy. And he's been taking my posts and putting them on Proteinaholic.com.
Nice.
To try to make it into a little bit more of to try to get some kind of more of a blog, because I just don't have the time to sit and do a blog and a Facebook post, and I just find Facebook kind of quick and easy to answer questions on.
Is Proteinaholic.com the best place for people to connect with you or find you, or is there a better website?
No, that's probably the best to find me. Proteinaholic, that would probably be the best to find me, and then Facebook is, you know, I'm on there as Dr. Garth. If you go on Garth Davis, you'll just get my political views. Take that with a grain of salt. So, yeah, Dr. Garth is where I do all the talking about nutrition and, you know, the latest in the news when it comes to nutrition. Do
you have a website with your speaking schedule? So people, because you're great in person, and I know that you're going to be speaking February 20th in Houston at Dr. Baxter Montgomery's conference.
Yeah, I sure will.
There, and I guess I'll also see you in June at the Remedy Food Project Conference in Toronto. So I know two of your speaking dates next year.
I didn't even know I was doing that Toronto conference. Am I?
I'm pretty sure you are. It's either, I think you are. I'm pretty sure.
Funny how disorganized I am. You know, I don't actually have. I need to put it. Maybe we'll put it on Proteinaholic.com. I need to put my speaking schedule on there. I can't. I wish I could speak, you know, more and all over the place, but you know, I got a pretty busy practice down here, so it's hard to get away and go and speak.
So, you know, I was wondering, because I've known personally, and I don't know what the statistics are, some people, and I would say actually many that have had gastric bypass surgery that have gone on to develop a drinking problem. Have you ever seen that happen?
Oh, yeah, certainly. The figure tends to be about 9 to 10%. But it's interesting, and I kind of mentioned before about, you know, obesity being a disease. Well, they did this interesting study. They took people that were overweight and people that were normal weight, and they did functional MRIs, which means they did an MRI where they can measure blood flow and brain utilization. And they showed them food. And when you looked at the brain of the normal weight person, not a lot of activity. You know, you show them food, yeah, I'm a little hungry, I could eat that, but nothing huge. You show an overweight person their brain, the brain lights up like Christmas. And their brain looks very similar in that state when they're looking at food as an alcoholic's does when it's looking at alcohol.
Interesting.
And so there's definitely this kind of, we call it addictive personality, but I hate that because it's really not a personality trait. It's an actual physiologic effect of a lack of dopamine receptors and arcuate nucleus, which is all big words to say that their brains are desperate for the stimulation that they're either going to get from food or from alcohol. And when we take away their ability to eat a lot of food, because you can't come home and binge when you've got a gastric bypass, that can lead you to drinking. And then other things happen. You know, a lot of our patients have been overweight since they were kids, and they lose all this weight, and you know, all of a sudden they're getting attention and people are looking at them, and this really plays with their mind a lot. It could get them to be going out more, be more promiscuous, drink more. And so, yeah, these kind of things do happen with our patients. All our patients have to see a psychologist beforehand. We always have support groups with psychologists. It's certainly not the majority of people that get weight loss surgery, nothing close, but it definitely happens.
Right. No, I've met more than my fair share, so I thought maybe there was something that had to do with, what I deal with in the Ultimate Weight Loss program that I run. Right. We do deal a lot with the emotional aspect and the emotional eating and the food addiction, and we find that it seems like everybody that I run across, there's reasons that they're using food to medicate, and if they don't deal with that reason or reasons, then whatever program they use to lose weight, it's going to come back. So I'm wondering if people that you see or that have a gastric bypass, do they just get the weight off, see that psychologist before, or do they ever really deal with is it really just the food that made them overweight, or is it more,
Oh, it's complex. This is not just one thing. There's so many things, which is why I think these weight loss surgeries need to be done in larger clinics that are staffed with psychologists and behavioral therapists and dietitians. Getting a weight loss surgery in an office where you see the doctor once a year, that just isn't adequate to be successful with the surgery. There will be people that are successful with that, but the vast majority of people need more support.
Yeah. Well, one of the things you said which touched me was that obesity has become one of the last bastions of acceptable discrimination in our society. Right. And you're right, because, now if you say anything, anti-gay or anti-certain religions or sexes, you get filed, you get fired or sued, but it does seem to be still okay, to tell fat jokes, or, like I remember like always hearing Joan Rivers make fun of Elizabeth Taylor, and I always wondered, well, why is that okay? You can't do that with somebody's color or sex or sexual orientation, or, but do you have a theory about that? Because I think it's horrible personally.
Yeah, look, I think people tend to look at people that are overweight, especially if you're a normal weight person. You think, why don't you just eat like I do? Why don't you just do, I have the willpower, so why don't you have the willpower? But if you haven't walked a mile in someone else's shoes, you just don't understand what they're going through.
Yeah.
And so I think it's just it's an inability to empathize. Like you could empathize with, someone who's missing a leg or missing an arm, but it's hard to empathize with someone overweight because you just can't get this concept that there's something different about them than there is about you. And so there's this idea that them being overweight is fat and lazy, and that they just want to, get, be so gluttonous, and that's the problem, and it really isn't.
Yeah, that's good, because it sounds like you have compassion for your patients, because I know that some doctors really don't seem to like overweight people very much. At least that's the sense that they get when they go there.
I get that from that 600-pound life sometimes.
Yeah.
I definitely have a lot of empathy for my patients. I get to see what rough lives they get, and what I get to see, which I most like to see, is how much they change. After the surgery, this fat, lazy mentality that you would put, that what people would stereotype them with, they go the absolute opposite. They become these vibrant, healthy people running around, doing races, active with their families in the gardens. And so, it's just dramatic that, they're able to get this kind of escape from this trap that they're in.
Yeah, that's inspiring, and they're lucky to have you to do that. One of the things I liked that you said in the book was that it's not hard for you to turn down things like a steak or a cheeseburger. Unlike most people, I have trained myself to be more attuned to what is really good for me and what is not, and thereby changed my taste. Now, was it a pretty quick process for you to change your taste from?
Oh God, no. It was a long, drawn out process, but it doesn't have to be that long drawn out. Mine was like this whole reading into the literature, finding out it's bad for you, and then thinking I need something more, because it's got to be more than just my health, and looking at how animals are treated, and reading the books Eating Animals, and then looking at the environment and getting this like kind of aha, like this fixes everything. This is, but this leads into an absolutely fascinating study to me, where they took, so back to that functional MRI where they're looking at people's brains, and they took the overweight people and they showed them cheeseburgers. Well, I can't even say it's cheeseburgers, something like that. They showed them food that they typically eat, and their brains lit up like crazy. Then they showed them food that, like a salad, and their brains didn't light up at all. It was like, I don't want the salad, I want the cheeseburger. Then they did what's called cognitive behavioral therapy and aversion therapy. And this is what I do with my patients. I have them take a picture we're so conditioned. We eat what we've eaten all our lives, and we get very conditioned to it. So, like a cheeseburger, it's actually a form of comfort. You have eaten it all your life, and anything you've done all your life becomes comfort. So you're stressed, you go for a cheeseburger. I used to love cheeseburgers. It was all I ever ate. I mean, that was my favorite thing in the world. I'd look at a cheeseburger and start salivating. Mm-hmm. What I have my patients do then is take a picture of themselves that they don't like. Holding their bag of medicine or something in a bathing suit, and take a picture. And then make a collage and take that picture and surround it by the foods that you typically like to eat, the cheeseburger and the pizza and all that stuff. And then put that up in your bathroom mirror and look at it every day. And this is going to have a conscious and a subconscious effect to have you start associating negative feelings towards these foods that you typically associate with comfort and things like that. And then the opposite of that is to take a picture of what your goals are. Like someone crossing a finish line of a race or whatever it may be, and then surround that with pictures of the foods that I tell them to eat, the fruits, the colorful fruits and the vegetables, and I try to tell them to look at the colors and smell the fruits and vegetables and look how vibrant it is, and compared to these kind of brown colors that you eat when you're eating a animal protein-based diet, and put that up and look at that very carefully, and also note that when you eat, like I just had a big bowl of brown rice, sweet potatoes, black beans and lentils. It was delicious, and I feel great right now. I feel fantastic. I don't have like a stomach ache and gassy and all this kind of stuff that you get when you eat a cheeseburger. And so really pay attention to that, and all of a sudden your tastes will actually change. And so they took these people and they did the study with them, and they brought them back and they showed them a cheeseburger, nothing lit up on the brain. Showed them the salad, brain lit up like crazy.
Yeah, that's great.
It's changeable. You could change your taste. You're not destined to always eat the way you always did, just so long as you're open to change and try these different techniques.
Right. It just seems people just they feel like they're giving something up instead of moving towards something even better.
Right. That's a big point I wanted to make in the book, is that it's not like people say you must have great willpower. I mean, for me, it doesn't feel like I've got any willpower. This is how I eat. It's how I want to eat,
Yeah.
There's just zero willpower involved in the way I eat now.
Do you find that being in Houston, it makes it even a little bit more challenging than, let's say, if you were in maybe Los Angeles, where everybody kind of...
you don't know until you go somewhere else. Recently, when I was in Los Angeles, I can't believe everybody's not vegan there.
You were in Los Angeles? You were in Los Angeles and didn't call me?
Yeah, we had the obesity conference. I forgot that you're there, but I was at conferences all day. But I would go out and go to Sage or to Crossroads and all that stuff. So you guys have ample opportunity. Yeah, we don't have much of that in Houston, but look, times are changing. I mean, every restaurant has at least one plant-based option entree. Very seldom going to a place where I can't eat something, other than a salad, but an actual entree that's plant-based. Even in Texas, I find it every time I travel. I could always find plant-based. I find it not difficult at all at this point in time. I mean, there is something everywhere to eat. It really takes almost no effort.
Yeah. But have you been able to influence any of your colleagues at all, or do they just kind of?
Oh, sure. No.
Great.
Lots of my colleagues. Yeah. No, I've thankfully I've had a lot of very open-minded physicians that have really been taken to this message and have changed their ways in how they counsel patients. And one of my best friends is a bariatric surgeon, and he's kind of slowly but steadily changing to a vegetarian diet and telling his patients to do it, and goes to my lectures and stuff like that. And it's great to see this kind of thing.
That is so cool, because that would really be a great way to affect changes with your peers, because then they would have a little bit more influence than some of us lay people,
Yeah, I really would like to get more into the doctors' brains. It's just a little harder place to get to. Yeah. They're a little bit shut down, They know what they've learned, and very dogmatic.
Wow, yeah. But you just proved that people can change. You changed.
Yeah, they said, no, people definitely can change. But what I really think our effort needs to be is in the medical schools.
Yeah.
That's where we really need to get them. And, the Physicians Committee for Responsible Medicine is really got a great initiative with medical schools, and that really is where the future needs to be.
That's
and get them while they're young.
Yeah, exactly. That's terrific. It's interesting though, is even though you did change, you like many people, dairy was the last thing to go for you. You said because that seems to be
Yeah,
a
by far. Yeah.
thing for a lot of people.
Yeah. Yeah, I mean, cheese is the hardest thing. I mean, cheese is very addictive. It has a substance in it called casomorphine, which just, acts on those opiate receptors that certainly with people that are overweight, they love that. But cheese is also loaded with saturated fat and high in calorie density and not high in a lot of other nutrients. And so, it's a problem food. And there came a time that I just, the vegetarian diet had only taken me so far, and I wanted to go further. And I had to draw a line in the sand. And I tell you, once you get away from it, once you break the addiction, you don't like the idea of going and eating a cheese pizza right now, which I used to do when I was vegetarian, just sounds disgusting to me.
Yeah.
You just get to the point where you're like, I don't want oily. I saw a patient today who I've been counseling for a long time now. She came to see me for weight loss surgery. I told her to try a plant-based diet. She kept losing weight. She still wanted weight loss surgery. I was like, well, let's wait this out. She kept losing weight. Now she is completely normal weight. She still wants weight loss surgery.
Oh,
So I'm like, you're a completely normal weight. We're not going to do that. But she was telling me today that, she is like, with all this stuff, she just lost her taste for oils and cheeses and things that are oily. She's like, I get this oily feeling on me. And I was like, yeah, I know exactly what you mean. It's like something clicks in your brain and says, you know what? I don't need that stuff. And then you don't want it anymore. Although I will tell you that from time to time I do love the Kite Hill cream cheese.
Oh, yeah.
And that's the other thing is it's become even easier to change now because there are alternatives.
Sure.
I don't like to push the alternatives because some people become, they eat almost the exact same diet they ate as a meat eater. It's just with, fake meats and
fake
this and fake.
Exactly.
Yeah, but I mean, from time to time, I'll use some of the fake cheeses, but most of the time I stick with, just like a dinner tonight, a bowl with brown rice in it, avocados, black beans, black lentils, pico de gallo.
Yum.
Easy, quick, delicious. I feel fantastic right now. That's what everybody ate like that. We would have a extremely healthy world. Yeah. Oh, and kale. I forgot the kale.
Oh yeah, even if you put yourself out of business doing gastric bypass, I mean, you're still a surgeon. There's other places you could probably operate, right, on the body.
Oh yeah. Look, I wish I could put myself out of business. I don't see that happening. I mean, our voice is loud, but it's kind of certainly. There's other louder voices out there that are making people overweight. But even so, I can always do hernias. Or I'm not worried about myself. I'll be okay. There's always a need for surgeons.
Why did you call the book Proteinaholic? What was that? Why was that in the back of your mind? Is that?
Yeah, it was the more I learned that we needed to do a plant-based diet. Everybody's got to be on a plant-based diet, but every time I would try to put them on a plant-based diet, the overwhelming question was like, I need my protein. I mean, I can't live without my protein. And then, I would tell people to eat apple for a snack, and I'd look at their diet log when they came back and it was beef jerky. I'd be like, why the beef jerky? Why not the apple? Well, the apple's got no protein. I needed my protein. I got to have my protein. And it sounded like an addict to me. It sounded like an alcoholic. Yeah. And so, that kind of name just came. It was like, that's a perfect name for this book.
That's great. I know. Actually, I was just curious, because the title of a book's really important. So,
Yeah. No, I mean, like the working title was The Protein Myth, and that just seemed kind of boring to me.
Yeah. No, it's great. It's great. It's a great title. I appreciate you giving a shout out to the animals in your book as well, even though that might not be, the first reason that you did this, but I appreciate that you said them. So you're a big jock now, aren't you? Did you always exercise even before you made the diet?
No,
I mean, your body.
No.
I have a picture once of your body without a shirt, and it was pretty impressive. But you did not always look that way.
No. I've got there's a before after picture floating around somewhere on the internet where, no, I was not. Look, I would go to the gym, like everybody else, once a month and decide that I was going to do it and then didn't do it. And I started with the diet, but then I started feeling so good. And what really got me with the diet was I was impressed that I could change, because I kind of thought you can't teach an old dog new tricks. We get in this rut, and then I was like, God, I can change my diet. And look at all these patients of mine that have been, overweight since they were kids, and now they're running marathons. And I got to try to see what else I can do. And I just, kept starting to, well, let me see if I could run a mile. Well, let me see if I could run a 5K. Let me see, and it really built up. And, now I keep a pretty active schedule. I switch between things. I do triathlons, marathons. I did a Spartan race this year. And now I'm doing a little bit more weightlifting. So I like to, vary it up to keep it up. But I'm more athletic than I've ever been in my entire life right now. I'm 46 years old.
That's great. Sometimes when people make one positive change in their life, it's easier to make others.
Yeah, absolutely. I mean, it really, it really provides motivation for the next thing. And kind of for me now, impossible is a dare, It's like anytime I think, well, that thing's impossible, and I want to go and do it and prove that anything's possible.
Wow. You're really just an inspiration. But as much of an inspiration as you are, who really inspired you? It doesn't have to be somebody in the plant-based movement, but just in life, because you really are so passionate, and it's really contagious. That's why I'm here.
Yeah, there's been so many different motivators. It'd be hard to say one. Like, Joel Fuhrman's Eat to Live was a big book in my life. I mean, that really got me thinking outside of the box because I'd never really thought about plant-based diets before. Dan Buettner's Blue Zones was a big thing for me. Neil Barnard's passion for activism and actually getting out there and doing something has been Neil Barnard's really one of my heroes.
Yes.
I just think he's such a great human being and such a motivator. I'm just so motivated by his just undying passion for what he believes in. On the athlete side, Rich Roll's transformation that he talks about in Fighting Ultra was huge to me. There's a lot of good role models out there that people can look to. I was just reading Shredded by Robert Cheek, which is a great book that are trying to do bodybuilding, and there's a lot of stories in there that I find really motivating. I was just reading, what's his name, Brooke Tadlock's husband.
Thomas Tadlock?
Thomas, yeah. Great story about him trying to build muscle, because now my thing is I want to build some muscle. So, mainly I do endurance sports, and I want to see if I could build some muscle just to see if a 46-year-old can do that. And he talks about how he tried to do it. He kept increasing protein, and then he met, some other vegan bodybuilders whose names are escaping me right now, but he then decided he was going to go lower protein. He went lower protein and gained more muscle. And that's these kind of interesting. And I could tell you physiologically why I think that happens. And I think it has to do with if you eat too much protein, it's too acidic, and your body tries to neutralize the acid by taking calcium from your muscles. But anyway, the long and short of it is there's a lot of stimulating stories and a lot of role models just in the book Shredded. And Robert Cheek himself is a great role model. So there's so many role models in the plant-based world now, and it's growing by the day.
Sure, and you're one of them, honestly. Your TV show, Big Medicine, is there a way to still see it, or is it still airing on television, or is there a way to buy it?
They still show it all the time. I don't know. There's got to be a way to buy it on. It used to be called Big Medicine, so you could buy that online, I think. I don't know. At one point, I bought a set of DVDs just to have it, so I remembered it. But, funny enough, I barely even watched the show because I hate seeing myself on TV.
I know. That's so funny. I feel the same way. Not hate.
Yeah, I just can't. I can't stand it.
So you're an author, you're a TV star, you're a surgeon, you're a speaker, you're a chef. Is there any part of your of all these things, is there one thing you enjoy doing more than anything?
Kind of above and beyond. I want to be a good dad and a good husband. I guess that would certainly be number one.
Sure.
I love
my those too, but I'm talking about the things you do for
there's nothing. My day-to-day job, though it's very busy and stressful, is I can't imagine. There's days I leave work and I just feel just this unbelievable sense of just well-being, and oh my God, today was a worthwhile day. And so I just feel I feel blessed to be in a position where I could help people like this, and so I like being an athlete and I like doing all that stuff, but nothing beats being a surgeon.
Really, that's great. Yeah, but your dad was a surgeon, so you probably sure that kind of inspired you maybe to go down that path. Didn't you used to go to work with him when you were little?
I did.
Yeah.
I always joke because people don't play baseball with their dads. I only went and worked with my dad. He's 16 years old in the operating room. So, yeah, and I've been around it for a long time, and I was always respected my father and his love for the art of surgery, and so yeah, it's been a huge influence on my life. But I think that he was a general surgeon. I think the bariatrics has given me because the one thing about surgery, you take someone's gallbladder out, you help them there, thank you, goodbye, you never see them again. It's not like this relationship, but with bariatrics, with dealing with patients on changing their diet, I feel like I'm being a preventative doctor as well as a surgeon, and I see patients and develop a really good relationship with them, and it's just been such a rewarding field of medicine. The job's great.
I always wondered, not that I've ever been anywhere other than maybe Japan, Mexico, and Canada, but what other parts of the world think about us, because from what I understand, we're the fattest and sickest people in the world now. And parts of the world where people are starving, and I wonder, they would think, why would you need bariatric surgery? I wonder how they look at Americans with this, because it's...
Hey, well, look, the world is changing. We're starting to, I'd go to these bariatric meetings. It was all America. There wouldn't be anybody from foreign countries coming to our meetings and stuff like that. Now it's filled with people from foreign countries. Even China's got bariatric surgeons now. So, as American and Western food spreads around the East, we're starting to see countries that never had obesity before developing obesity. It's happening in Okinawa, one of the, blue.
Oh, that's crazy. I find it so disturbing.
Yeah, it's infuriating. Yeah, and what's infuriating is the more Western we get, the more the demand for meat, the more we don't grow the other crops, and we eat a fraction of the edible fruits and vegetables that are out there, and that number drops as we lose seeds and we lose stuff to these big factory farms, and the soy and corn that's grown just huge swaths of land just dedicated to producing grains for meat to eat, and that's sad. We're getting such a our variety of foods, our variety of just animal existence is dropping tremendously.
So, just fun question: what's your favorite meal?
I love bowls like I just had for dinner. I'm so enamored with my very quick, very easy, just delicious dinner tonight. But I love sweet potatoes, and I love beans, and I love pico de gallo, and I love kale, and I love mixing those all together in a bowl. So that's probably my go-to favorite meal.
It's a great concept. Do you do any of the cooking at your home? Because I know you're a PCRM cooking instructor. I don't know how you time to do all this.
Yeah. Well, we haven't done a lot of those classes lately. We need to get back into it. It's just too busy. But my wife's definitely to cook. She does everything. She does her plant-based diets. Her plant-based cooking is fantastic. So
and
she's a cook.
Yeah, and a lot of people are very upset to hear there is a Mrs. Davis, because I'll tell you. They just think you're something, because you're just such a handsome guy, and you're just so nice. You're just so you're a good person. I've seen you,
thank you.
And you're just really as nice as you are, passionate and talented. So what is next for you? Any
I really want to. I want to work on this book. I just really, the thing about the book is that it's doing really well, and I'm really excited about it. But I feel like a lot of the audience, I'm preaching to the choir.
Yeah.
And I'd really kind of like to get this book into the hands of my patients before they're my patients. The people that are out there, trying to do these high protein diets and thinking that everything's about protein and eating tons of meat. And I'm optimistic that we can keep growing the book and try to get a little bit more mainstream coverage, not because I want fame in any way, shape, or form. In fact, I would just as soon be happy not having it, but more that I really, really want the message of it to get out there.
I was going to say you'd be a great one to debate Dr. Atkins, but unfortunately he's dead from his own diet, so that's not good.
That's right. I'd be happy to debate any of the guys up there. Every time I see these guys, paleo, it doesn't matter. They're so out of touch with the science that it would actually be, the debates would be fairly easy for me, but I'm happy to do it. If anybody out there wants to challenge me, I'll do it.
That would be great because you're such an eloquent speaker, and you're passionate, and you know the science. So I can't think of anybody I'd rather see in a debate of this kind. Should they have another one? You know, it's so funny because yesterday I watched the USDA debate from many years ago with Dean Ornish, Dr. McDougall, and Atkins, and I actually thought about you. I said, boy, I wish he was around then, because you would have given it to him, you know.
Yeah, you know, the funny thing is, like, Dean Ornish is such a brilliant guy. I mean, the guy should be a Nobel laureate for the work he's done. But he doesn't debate. Well, he's too nice.
He's too nice,
in the debate settings. You know, he's still, I see your point. You know, forget that. This is like life or death stuff.
No, that's what I love about you. I just love that part of your personality. You're sort of like you're like a yellow lab, but you got a little bit of pit in you. You know, just
I got a little bit of me. That's right. I just can't. You know, like there was the worst debate ever, and it just kills me to think about it. Is Gary Taubes versus Dean Ornish on Larry King. I mean, Gary Taubes was just such an ass during that thing, and he didn't let Dean speak at all. Dean was trying to be polite, but that was not the place to be polite. Right. And let me tell you, there's no one I would like to debate more than Gary Taubes, because his book is an abomination to me.
Yeah,
it's so filled.
You know, I remember when he was on, even Dr. Oz didn't seem to like him, and Dr. Oz seems to like everybody, because I remember that he wouldn't even reveal what his cholesterol was. He just not a very likable person. I would love to debate him. I'll see what I can do to set that up now that I know that. Well, thank you so much for coming back on. Your book is wonderful. If you have not read Proteinaholic, not only read it, but it makes a great Christmas present. It's really a book that you need on your bookshelf wherever you are in your plant-based journey or just journey to health in general. And again, to find out more about Dr. Davis, go to proteinaholic.com. Please get the book, everybody. It's fantastic. And come to Toronto in June to hear Dr. Davis speak, or Houston in February, because he is even cuter and more passionate in person than he is on audio. So thank you so much for being here, and thanks so much for the work you do.
Oh, thanks, AJ. I've got a big head now, so I won't be able to fit through the door.
All right, and make sure to follow Dr. Garth on Facebook, because those posts are it's really the only reason to get on Facebook. It's really the only worthwhile thing, in my opinion, to read is your posts. They are just so fun and inspirational. So thank you so much, Dr. Davis, and thanks all of you for listening to the very last live Healthy Living with Chef AJ. We'll keep doing these, but we're going to pre-record from now on. It makes it a little easier for our guests. So thanks to all of you. I'm Chef AJ, and I make healthy taste delicious. Good night, everyone.